Thank you, everybody, and thanks for this great invitation to be here with all of you, just from the Netherlands, sharing our experiences with you about, I think, a very important topic about collaborative governance. But the most important thing is that my passion and motivation is about how we organize integrated services better around people, and also what it means, what kind of governance do you need. So that's the main topic of all the work I do. It's all about knowledge about these kind of topics and how we really make it happen in practice. Yes, because we have to move forward. You have to move forward in Canada and North America, but also in Europe and everywhere around the world. And we do have some challenges. And I think we can learn of each other because we do have some same challenges also at the same time. I don't have to tell you again about the changing demographics, the shortage of staff, which is really getting more and more urgent also in my country, but also the need for involving communities and civilians and about, you could say, everybody. And how do we do it? How can we be more supportive communities, more supportive countries for the people who are the most in need? And I think that it's also important that we look again about how we organize and how we implement and have arranged our governance models. So, and by governance, I don't really mean on the national level with legislations and things like that, but how do we do our leadership? How is the steering on integrated service networks? How do we do supervision? How are we being accountable and things like that? So it's about that. How can we do that in another way so that we really support the aims that we want to reach? So, and we don't only need science, we also need your knowledge, we also need practice experiences, because we are on a kind of a time pressure, because we need solutions now. And of course, knowledge development sometimes always also takes time. And if you look at this topic, and also if you look in a more broad view about the literature about integrated care, you mainly see four, you could say, large strategies to work on. Of course, strengthening communities, people themselves, is very important. That's a major strategy also to deliver another way of support and care for people. That's from a broad perspective, because a lot of topics and issues which look like healthcare issues are issues about the conditions of people, are about how they live, how they work. So it's not only about health, it's about that broad perspective. And when you look at that, it means that the healthcare perspective is way too narrow always to really have the impact that you want. So for healthcare workers, people who work in the field, and also leaders, it's very important to have more shared services and shared interconnected networks. And that's a large development we see worldwide, but also in our country, especially also because now in the Netherlands we have also an integrated care agreement, where it's more obliged also to work together. So how do we do that? Because the governance is often focusing on the organization or on the professional. So we really need a turnaround in that governance. So of these four strategies you see on the slide, we now focus on the third one, who is about the how-to governance issues. So transforming governance, what to do and how can we make it work? So what we need is a little bit of turnaround. And as Jodine also said, it's not only about structures, but it's also, I would say, about how we do it and how we arrange it. It's not only about informal agreements and things like that. You need them all. So you need suiting structures. How do you organize it? What kind of agreements do you have? Who is responsible? How do you do decision making? You have to rethink that and arrange that. Of course, this takes time. You can't do it in one day or 1 year. These are multiple time. These are long-term processes. You have to learn, you have to build, but you also have to involve people, because the commitment is very important. And also a next step is that you don't have to work only about your structure, your leadership, and who's involved. It's also about another way of being accountable, another way of arranging supervision about quality, but also more external supervision, you could say, about are doing healthcare providers and leaders the right things. So you need them all. So it's a kind of a puzzle, you could say, and it's really a learning in progress. So that's why the arrows keep going around and around, and you have to refresh and adjust and learn over time. I will start with you with the network modality. And in this slide, it was the green thing because the citizen involvement, because I'm working now more and more on that. And I think that's a very, very important piece of the puzzle where we really need more knowledge about. So I think it's very good to also have the citizen or patient or perspective on board, literally on board, you could say. Okay, but let's start with the network modalities. So how do you do it? The inter-organizational connections. How do you make the connections? Well, of course, it's good to see what kind of options do you have? What kind of choices are there to make? Okay, because it's all about connections. It's about relationships. What kind of form, what kind of structure, you could say, is suitable for that aim that you are working on? So here you can see some of the options there are. So with how many organizations are you working? Is it only 3 maybe, or do you have 30? So also what kind of modality suits the way you are working and that you can really achieve results? Here you see just 5 options from the work of a colleague of mine of Tilburg University. And for instance, you can think about, do you need one lead organization? So do you want to have a structure where you say, okay, we work together, for instance, as 10 different organizations to reach the aim, because we can't do it alone, but we need one lead organization and we accept that, we arrange that, and the lead organizations make agreements with the other ones. Maybe that's not the most suitable structure. Maybe you don't need that. So you are all equal, you could say. Or maybe you need a structure where you say, well, we need one organization who is not really a party, you could say, that also is delivering support or care, but is a party that's helping the progress and helping the collaborative process. So that's, you could say, it's a kind of a glue between all the participants in these kind of services. That's also a possibility. And maybe you need both. Maybe you say, okay, I need a kind of a collaborative model in which we have a difference between parties and organizations who are more involved, you could say, like in the 5th figure. And we have others who are also very important, but to steer it and to make progress, they are a little bit more, you could say, a little bit more on the informational level than really also steering our collaboration. So the conclusion of this slide is that there's not one perfect model, but it's very important to see what fits your situation. Because when you choose a kind of situation or one of these models, you have to make arrangements to each other. And there are also different balances, how you build relations, how powers are divided, how maybe decision making is organized, etc. So there are some lessons, you could say, which I already explained some about. Very important that if you work on the governance, it's not really a project. It's not a time project where you say we start and we end and we work on that. It's really something that has to be durable over time. It has to be sustainable over time. So working on new modes of governance is something for the long term. So you can't just fix it with project groups and steering boards and things like that. You have to evaluate it and also see, is this really working? Are we really working together with all the parties that we need now or not? So maybe another organization should be included in our collaboration, or maybe one who is included should not be included anymore. You have to dare to evaluate and to change to make the best outcome for the persons and citizens where you're working for. So, and also you have to think about what's the kind of scale, what's the object, where are we working on? What's the area we are responsible for? So that's the issue about scale. And there are some publications about scale issues. Are you working local level? Are you working on regional level? And what exactly is then the local level? Do you have all together, with the organizations you're working on, the same idea about that? So this is just one piece of the puzzle, you could say. But of course, there's more. Because when you want to make progress, you also have to think about how do we make decisions? Because it's very complex in such a situation where you have a collaborative governance model. Because it's not just the one single organization with the board of directors who can decide whatever they want, you could say. So decision-making in collaborative models is quite complex, you could say. So, and what we see is that there's often not enough attention, I would say, for the decision-making process. But it's very important because only by decisions, by good decisions who are really also adapted and work on in practice, you get progress, and that's important. So what's the complexity about the decision-making in these inter-organizational collaborations and these networks? One of our colleagues did some nice research about that, and it's just been published in the International Journal of Integrated Care, because decision-making in inter-organizational networks or in collaborative models is quite complex, because you work together, because you are interdependent of each other. But at the same time, you experience that persons, people, but also organizations really think that autonomy is very important. So that's a kind of tension or maybe a dilemma. How do you deal with that? Another important dilemma is that you work together because you are different. Because otherwise, if you can do it all by yourself or alone or with your own team or whatever, you don't have to really collaborate. So you are diverse, and the diversity is very important. But at the same time, you are striving towards coherence. You want to achieve something together. So you are different, you have different views, different ideas, backgrounds, and things like that, but you strive towards coherence. So that's you could say it's a dilemma which is already present because of the way you are working and collaborating. And the last dilemma is that you want to strive to common goals, you have a nice ambition, you want to have better services, better support, care, whatever you are striving towards. So you have a common goal where you're working towards. There's a kind of a basic assumption for working together. But also there are interests of the different organizations themselves, of the different professions, the different people. So there's also the third dilemma, which is balancing between the common goals and the self-interests. And that comes together in the dilemma of how you arrange your decision-making. And the dilemma is the balance between efficiency and also inclusiveness. Because you can imagine, you want to be inclusive so that everybody is involved, everybody will agree, but that can be very time-consuming. So how do you balance about these things? And what we learned and also see is that you don't really have to choose for one option, because you also can see, you can decide that different decisions can have different models made. So that's also something to think about. So if you have a kind of a way of working together or a modality, you think about how do we do the decision making? What kind of approach fits what kind of decisions? And how can you balance between efficiency and inclusiveness? And you have options. Of course, the most efficient option is that you say, well, decisions can be made by one person and we only give them advice, or one organization. But you can imagine that does something with inclusiveness or adoption or whatever. And you have also other options for where you want to have everybody who's agreeing. So decision making and thinking about how you do these processes, what kind of way of working for decision making do you integrate into your collaborative service, in your collaborative governance, is very important. Another topic which is very important and what's also getting more and more interest in our country, the Netherlands, and hopefully maybe also in your country, is not only about how you arrange it with each other, but also what does that mean for supervision, for external supervision, for instance, of quality inspectors, but also for the supervisory boards you have. Because, for instance, in the Netherlands, all healthcare organizations do have, of course, their CEOs and their boards, but we also all have supervisory boards. And they are trained to look at the organization. They feel responsible for the organization, but the value is being delivered in the collaboration. So you have a collaborative work agreement with other social care, healthcare providers, or whoever. So there's a collaborative aim, a collaborative goal. You work together, but the supervisors are focusing on the organization. And they are a bit worried. How do we do that? We have all these collaborations, and one organization is not involved in only one organization, one network. They are involved in multiple networks. How do we do other modes of supervision? So we're now starting a new research from Tilburg University and Amsterdam University to really co-create with practice other ways of supervision that really are focusing on the inter-organizational arrangements, focusing on the aim that you want to deliver together. So let's skip a little bit to the more relational aspects also of the collaborative governance, because you have to work together and it's all about people, relations, and how to work together. So the circle is a little bit in between because I couldn't choose, of course, but I had to choose a little bit because of time. I want to tell you a little bit about the importance of underlying values, because values drive behavior of people, and also the involvement of just old people, because we need more governance models that are not really focusing on just having organizational models without all kind of hierarchies and etc. We have to involve the people who are really affected by the services, who can express what could be the right services and support. So the people themselves, the civilians, the patients, or whatever name you want to do for the people who are just like you and me. So to understand a little bit about this is what the work of Nick Sonneveld, which is a colleague of mine, who is working on his PhD and is focusing on what are underlying values which are important for decision-making, for driving behavior of people. So you have to also pay some attention. How do we work together? What do you think is important? Why are you working with me or not? Because, and it's important because if you don't see what kind of values are underneath, then it's also sometimes more difficult to understand behavior and also to talk about other things than just about activities, tasks, processes, budgets, and things like that. What's important? Why is it important to you? And what are your value priorities? What's more important and what not? So we can't go through all this work of Nick, but what's most important to remember, and there are a number of publications also to read a little bit more about it, is that it's also important to discuss with each other what kind of values do matter to you, what kind of values do matter in your integrated services, how you want to work together. And what we also discovered in his work is that its values do differ. They are different. So we also see that, for instance, professionals do have other value hierarchies than patients, do have other value hierarchies than, for instance, policymakers or finances. So people are, of course, diverse and look from a different perspective. Most of the time, they do have good intentions, but the values are different. And you also have to think and realize about these kind of aspects. So how can we also come to more inclusive and more collaborative governance models? Also, where we involve the people who are we are working with and for. And the pictures are in Dutch. I apologize for that, but maybe you can imagine a little bit about what's on the slide. So what we need is also more and more, because what we see also in our country is that there's a shortage of a lot of things. There's a shortage of staff. There's a shortage of budget, you could say. So we have to make choices in the future. And the choices will be not that easy, maybe. And it's good to make choices also for what do you do, what kind of services can we deliver, what's not possible anymore. What do we expect of people themselves, to have these kind of discussions, to make these kind of decisions also with the people themselves. So we need to involve society, you could say, also in our governance models, the people who are working to and for. But how do we do that? That's not that easy. Of course, you can say it, but how can we organize and arrange that? I think we're now in a time frame that it's very important that we work on that we experiment with that and see what's work and how can we do that. So we have to move forward from the way of, well, asking people to sit down in formal committees with agendas and minutes and things like that, to have a more dialogue and a conversation about what's the right way to work together, what are the aims, what choices do we make, and also enrich ourselves with that perspective of the people themselves. And we can do that in a lot of ways. So I think there's not one option or one way to do that. What we see, for instance, that using also the wisdom of the crowds, there are some nice methods to do so. For instance, like the deep democracy methods, to use them also in your governance. How can you do that? How can you use the wisdom also the people who are silent and you don't hear at the first moment? Also, we can use technologies also to listen to people, to hear their voices, to get input, especially when it's about a large amount of people. So just a little explain in this webinar with using a poll, you can very quickly ask on all of you what a question or an opinion or whatever. So that's a very quick way of having more an idea than just asking 3 people of you. So we have to be creative and also think, how can we do that and work that and integrate that in our governance models? And now in the Netherlands, we also see that in a lot of regions and communities, we're trying to have a kind of groups and councils of people, civilians who can think about and think along also with people who are working in health and social care. Different ways, also different examples. And this is, I think, an interesting example of something we learned in Finland. So the international learning is, of course, also very important. And we're very curious how it will work out, because they will start with it in January this year. We learned before when we visited Finland in the winter. But for instance, there they are trying to build up a governance model in which people from the county, the municipality, or different sizes, smaller or larger municipalities, they have a kind of a way of county elections. So people, just the citizens, you could say, can be elected, and they have a kind of a well-being county council. People who can have influence, you could say, on the board of that county, who will arrange and make decisions for the health and social care services in that specific area. And of course, someone has to work with the organizations. There is a CEO. But here you see just an example, and we are not sure how it will work out, but that's interesting to follow. How can you really involve people in a certain area also into the governance model? Well, I think we still have to learn a lot about that. But this is just an example about how in Finland they try to work on that. So I think the time is also now there to work on these kind of models and to learn and to experiment, also to have a more shared collaborative governance model where we mix the importance of having good modalities. So that was the first piece of the puzzle. Have clear ways and also fitting ways of decision making, because we have to make progress, and sometimes we can't decide everything with everyone. That's not possible. That's also not efficient. But we have to be inclusive, because what we do has to be supported by the people who are responsible for it. They have to be. It has to be supported by the people who are working in the health services, but also for the people who are involved in receiving the services and care, and also the way of working together with others, because it's something for all of us, because in the future, it's very important that we see that health and services are really connected in society with all other life domains, like living, like housing, education, and things like that. I want to conclude by that, because I want to also share the floor with my colleague speakers. So I think we have a lot to do in working on new governance models. That's also a major step also for people who are leaders, who are in boards, for financiers, for supervisors. So it's something for all of us. So we have a lot to do. We have a lot to learn also from each other. But the good news is also not everything, but there's also a lot in our hands. So thank you for your attention, and I'll wish you also very much good luck in working on this important topic of collaborative governance.